The mantra of any lawyer is, and it should be yours, if it's not written, it didn't happen. So, for example, you could do brain surgery for 6 hours. If you did not write that your patient was anesthetized, the lawyer will assume that the patient was not anesthetized. It's that simple. It's silly, but that's the way it is. So if somebody wrote routine spay, period, end of the surgery report, end of the anesthesia report, and something happened, I can tell you, based on PLIT, that you're completely liable because you can't prove any of what you did. And so not only from a legal standpoint, but also from a, I would suspect from a Practice Act standpoint within your state, because you're obligated to document stuff. So if you wrote routine spay under routine anesthesia, well, that's no better. If you wrote, not you maybe, but your tech, gave CAT-VAL, then ISO, it's the beginning of something, but it's not enough. Now, if you write, or your tech writes, 10 a.m., endotracheal tube placed, then ISO and oxygen, with a bunch of other information, that's okay. But ideally, it should be 10 a.m., size 10, endotracheal tube placed, then relay on ISO and O2, et cetera, et cetera. Now, we're not even in surgery. This is just induction here. Now, in surgery, again, I go to very good practices. I only go to good practices anyway. There's no anesthetic record. So if anything happens, I'm not in charge of anesthesia. They are. They would be 1,000% liable. So intra-op, you're obligated in 2013 to document everything. Times, when you give cefazolin, when did you give it? How much did you give it? Which route did you give it? And all the vital signs you can possibly monitor. If you monitor pressure, for example, and your patient is hypotensive, it's got to be documented. If you do something to correct hypotension, it's got to be documented, and so on and so forth. Everything you do or your tech does has to be documented. That's as simple as it gets.